You're listening to Simple Health Radio, the podcast about recognizing medical emergencies and promoting wellness. Your host is Dr. Emran, an experienced ER physician who has treated thousands of people just like you. Information on the show is not a substitute for professional medical advice. Always talk to your doctor or go to the nearest emergency room with any questions you may have.
Thank you so much for joining me on this week's episode of Simple Health Radio. I'm your host, Dr. Emran. On today's episode, I will discuss a case of a patient I saw about 6 months ago. Her name is Josefina. She was a 55-year-old healthy Hispanic female. She was involved in a car accident, and her doctor had prescribed her some medications to help with the pain. She saw me after 2 weeks of taking those medications and after her accident, and she had generalized severe abdominal pain. She felt like her stomach was bloated. She was unable to eat. She was unable to go to the restroom properly, and her family became concerned because this was not her normal state of health. She told me that she had not had a bowel movement in almost 5 days. She had been going to the bathroom over and over again, but nothing would come out, and her pain, especially in the back and the abdomen, was beginning to worsen. When I examined her, she was very tender, but had no fever. She had normal blood pressure. She had no signs of any dehydration, but she was visibly uncomfortable. When I looked through her chart, it was consistent. She had no other medical problems. She was not known to be a diabetic. She did not have any history of surgery. And besides the new pain medication, nothing had really changed in her life. We did some basic testing on her, and the results did confirm that she had severe constipation, and that's what we're going to talk about today. So in the case of Josefina, the story is very consistent. Whenever people start a new medication, there is always a chance that the digestion, the natural process in the body, is going to be disrupted. In her case, she had been prescribed some very strong pain medication. She was taking Percocet, which is an opioid medication. She needed that because of her back injury from the car accident, but she had been using it almost around the clock. The body has special receptors that are opioid dependent, and these are receptors that help to block pain when the opioids bind to them. They do their job very, very well. The problem is that the intestine actually has receptors as well. And so the opioids, when they bind to those receptors in the intestine, it slows everything down. And that's what led to this patient's constipation. She had basically overdosed on accident and taken so much pain medication in a short amount of time that her intestines weren't able to keep up. And that affected her digestion, which directly led to her severe constipation. Now, in the United States, last year, there were more than 8 million doctor visits to a clinic, ER, or an urgent care center related to constipation. So that means it's a very, very large problem. The normal process of digestion is a term called peristalsis. So peristalsis is the intestine's ability to move the food down the intestinal tract. And what happens is there are natural squeezing actions that help to propel the food slowly going forward, and that allows the body to absorb the vitamins and the nutrients. Now, there are 2 types of intestine. There's the small intestine, which is actually long. It's actually longer than the large intestine. But we call it the small intestine because the caliber or the diameter is smaller compared to the large intestine. Now, the intestine, as you know, has curves and loops. It has to have some twists and turns in order to fit inside of the abdominal cavity. But that's the areas that are very, very sensitive when people become constipated. In this situation, the opioids, which were the Percocet, caused the peristalsis to slow down. The small intestine was still functioning well because she was able to eat and digest in the upper part of her intestine, but the lower part of the intestine was so full of stool, nothing could go past it. It was almost as though it was becoming impacted. And when we did the basic testing, which included a chest x-ray, abdominal x-ray, and a CT scan of the abdomen, it confirmed that she had a large amount of stool, but no signs of any infection, no signs of any bleeding, and no signs of any other tear. Now, there are other causes for severe constipation besides opioids. One of the most common is actually iron. Iron is a mineral that's necessary to create blood cells, and it helps to control anemia. Many pregnant women will be prescribed iron to help build up the hemoglobin, which allows them to be prepared for a healthy baby, a healthy delivery. Other people will be prescribed iron if they have surgery or if they have other types of iron deficiency anemia. Iron is a metal, and so this causes naturally some stress to the intestine, which slows it down, causing a direct link with constipation. Other medications, including blood pressure medicine, can also cause constipation. And then there are several hormonal causes that can actually lead to constipation. Hypothyroidism, which is a condition where the thyroid is not active enough or it's not produced enough in the body, slows down digestion. And diabetes can actually cause severe constipation because it damages the nerves that are naturally stimulating the intestine, and that's called gastroparesis or diabetic neuropathy. Now, as we talked about earlier, peristalsis is the natural movement of food through the small intestine, through the large intestine, and out of the body. However, peristalsis is automatic, so the brain tells the intestine what to do at what time, but we physically can't control it. This is all part of the autonomic or the parasympathetic and sympathetic nervous system. So these are conditions that we have to be very careful with because medications and other chronic issues directly affect the nerves that are in the body. Now, going back to the constipation causes, besides medication and besides the hormonal issues, cancer and fissures and other blockages in the intestine can lead to severe constipation. And that was one of the reasons why I had done the x-rays and the CAT scans. All of those came back normally. And of course, what we eat has a direct link on our digestion. So in this patient's case, she had a fairly good diet. However, more fiber would be beneficial to help move the food and stool through the intestine. Some people will take fiber supplements. These include medications that are over the counter. One is called Miralax, which is basically a powder that you mix with water or juice and you drink it. And this will bulk up the stool, allowing it to pass more easily. Other people will use Docusate. Docusate is over the counter, and this is a stool softener. So this medication works very slowly to soften the stool, allowing people to use the restroom without having cramping or pain. Simethicone is an anti-gas medication commonly found either as a pill or mixed in with a liquid such as Mylanta or Maalox. Some people feel very bloated when they're constipated, so using simethicone may help to reduce some of that bloating. Senna is an over-the-counter laxative that stimulates some of the nerves in the intestine to become more active. You have to be careful with Senna that you don't use it too often, otherwise your body becomes a little bit dependent on that. Then there's other treatments that are not medication-based, such as exercise. So walking is a very proven way of reducing constipation because of the physical and the mechanical actions that occur. So people who have frequent constipation, I do advise that they walk for 30 minutes or an hour a day, sweat a little bit, and that actually improves their digestion rapidly. Probiotics, which are healthy bacteria, are also beneficial in preventing constipation. The simplest form would be in yogurt, and it could be any brand, any flavor, and as long as you take 1 or 2 servings a week, you'll naturally increase the healthy bacteria, which can help to break down your food and reduce the risk of constipation. Prunes and dates and figs are all in the same category. They are fiber-rich foods that have basically no side effects, and that also improves the ability to digest and have normal bowel movements. Enemas are a type of medication that come in 2 forms. There are stimulant enemas, which stimulate the nerves to actually forcefully eject the stool, and then osmotic, which is basically where the body cannot absorb it, and so the bulk of that osmosis forces the person to have a heavy bowel movement. Enemas are used rectally, so these come in either liquids or small gel type of capsules that are inserted in the rectal area. They can be used for children and adults, but again, you have to be cautious that you don't overuse them because the body can become dependent on that. One of the most effective treatments for constipation is actually honey. So honey is a very, very safe and effective option for anyone who's over at least 1 year of age and who's not diabetic. Honey is taken orally. You can take 1 teaspoon or 2 teaspoons, and it's preferable to take it on an empty stomach first thing in the morning. The honey will go from the stomach into the intestine, softening up a lot of the stomach, the intestinal walls, and it's a natural stimulant. So that allows people over time, after they use honey for several days or several weeks, to actually calm down constipation. And again, it has a lot of reduction in inflammation properties, which are beneficial overall. So I always recommend people look at what they're eating and also look at what they're drinking. So people do need to increase water intake if they are constipated, and oftentimes people become dehydrated or they drink other things that are not as healthy for them, which cause constipation. So look at what you're eating, increase your fiber, drink more water, take more walks, and that may solve the problem. If it doesn't, you can try a short course of Docusate or simethicone, and then definitely try honey, prunes, figs, or dates, because those will be very beneficial. Now, going back to Josephina, who was my patient in the emergency room, who had 5 days of severe constipation, could not go on her own, we had to give her an enema in the emergency department. And within about 30 minutes, she had a very large bowel movement. She felt tremendous relief. She was very grateful. And it sounds kind of unusual, and it might be a little bit embarrassing, but if you've been constipated for 5 days and you cannot go to the restroom and you're in the emergency department at 2 o'clock in the morning, the happiest sound that you can hear is someone actually going to the restroom and feeling very, very good. So she was discharged home, and I'm pretty sure she stopped taking all of her pain medications after that time, because I haven't seen her back since. And if you have concerns about constipation or any of the issues that you think could be linked to constipation, talk to your doctor, look at what you're eating, look at the medications you're on, try to do the natural remedies first. But if that doesn't work, there are prescription medications that may benefit you, but you want to be tested and rule out all the other bad stuff first. I'd love to hear your experiences regarding any medications that may have caused some side effects for you, so that I can increase the list and increase awareness about what things to avoid. If there are other foods or other home remedies that you have that are effective, please share those with us on social media, and I'll be sure to include that in our show notes and blogs as well. And again, thank you so much for joining me on this week's episode. I look forward to having you again next time.
We hope you enjoyed this week's episode. Visit simplehealthradio.com to read the blog, follow links mentioned on this episode, and easily share content with your family and friends. Subscribe to the show on iTunes, Spotify, YouTube, Spreaker, iHeartRadio, and the 3&0 Radio Network. Be sure to connect with Dr. Emran on Twitter, Facebook, Instagram, Pinterest, and Tumblr to send us your questions and ideas.